Hello, my dear viewers. Today we are going to see about ectopic pregnancy, another subject in gynecology. Okay, before that, if you are not subscribed to my channel up to now, please subscribe and click bell button and share with your friends. Then only you can view my future videos easily. Okay, so welcome to Sri Press. Let's go to the video about ectopic pregnancy. Very interesting subtopic in gynecology. Ectopic means extrauterine pregnancy. What is ectopic pregnancy? If you ask in the examination, you can answer ectopic pregnancy. Called extrauterine pregnancy is when a fertilized egg grows outside a woman's uterus somewhere else in their belly. It can cause life-threatening bleeding and needs medical care right away. In more than 90% of cases, the egg implants in a fallopian tube. This is called a tubal pregnancy. The signs and symptoms of ectopic pregnancies. We are going to see about the signs and symptoms. Most of the time, an ectopic pregnancy happens within the first few weeks of pregnancy. You might not even know that you are pregnant and may not notice any problems. Okay, early signs of an ectopic pregnancy include light vaginal bleeding and pelvic pain, upset stomach and vomiting, sharp abdominal cramps, pain on one side of your body, dizziness or weakness, pain in your shoulder, or neck or rectum. An ectopic pregnancy can cause your fallopian tube to burst or rupture. Emergency symptoms include major pain with or without severe bleeding. Call the doctor right away if you have heavy vaginal bleeding with lightheadedness, fainting, or shoulder pain. If you have severe belly pain, especially on one side, please call your doctor. Okay. The ectopic pregnancy causes and risk factors. We are going to see what are the causes and risk factors. You may never know why you have an ectopic pregnancy. One cause could be a damaged fallopian tube. It could keep the fertilized egg from getting into your uterus. You are more likely to have an ectopic pregnancy if you have pelvic inflammatory disease, we called PID, or smoke cigarette, uh, are older than 35 years old, have sexually transmitted infections, have scarring from pelvic surgery, had a previous ectopic pregnancy, tried to have a tubal ligation tube tied or tubal ligation reversal, use fertility drugs, had fertility treatment such as in vitro fertilization, so-called IVF. It could also happen if you become pregnant while you have an intrauterine device called IUD for birth control. The diagnosis, when then we are going to the diagnosis of ectopic pregnancy. Your doctor will probably do tests that include a pregnancy test and pelvic exam. They might give you an ultrasound to look at your uterus and fallopian tube. The treatment of ectopic pregnancy. Next, we are going to the treatment of ectopic pregnancy. Because the fertilized egg can't survive outside the uterus, your doctor will need to take it out so you don't have serious health problems. They'll use one of two methods: medication or surgery. Medication, if your fallopian tube hasn't ruptured and your pregnancy isn't far along, your doctor can give you a shot of methotrexate. It stops the cells from growing, your body will absorb them. Surgery. In other cases, you will need surgery. The most common is laparoscopy. Your doctor will make very small cuts in your lower belly and insert a thin flexible tube called a laparoscope to remove the ectopic pregnancy. If your fallopian tube is damaged, they may have to remove it as well. If you are bleeding a lot or your doctor suspects that your fallopian tube is ruptured, you might need emergency surgery with a large cut. This is called laparotomy. After an ectopic pregnancy, it might be hard for you to have a typical pregnancy afterward. Consider talking to a fertility specialist, especially if you had a fallopian tube removed, and talk to your doctor about how long to wait before you're trying again. Some experts suggest giving yourself at least 3 months so your body has time to heal. if you get pregnant again, since one ectopic pregnancy raises your risk of having another one. Be mindful of changes in your body until your doctor can confirm that is growing where it should. Okay, that is end of the video. If you like this video, please subscribe and click bell button and share with your friends. We'll see you in another video. Thank you very much for watching this.